This is Dr. Chris Shaver, and welcome to the GI Show. And we're filming here from the lovely and picturesque BGA Studios. And we're glad to be with you today. Today we're bringing you a special GI Show episode. This is episode number 3, and it's important for us to discuss COVID-19 with our gastroenterology liver patients. So, what I'm talking about, COVID-19 is the virus, the coronavirus that I'm sure you've heard about, that is now a pandemic and now is increasing in this country, in our state, and probably in your state. West Virginia, you did good for a while, but I think we finally saw some cases in the lovely Mountaineer state. But wanted to kind of give you a gastroenterology perspective, just so you can kind of hear it and understand. Remember, our goal here at the GI Show is to educate, inform, and inspire gastroenterology patients on your health journey. So that's why I really wanted to kind of touch base with you. Remember, I'm not an infectious disease specialist. I'm not a pulmonary doctor. I'm not an ICU doctor. I'm a gastroenterologist. But this virus really hits on a lot of different specialties, and something that you need to know about and understand. So COVID-19 is the disease. The virus is called SARS-CoV-2, and it's pandemic. It's everywhere. Some countries are more involved than others. It obviously started in China, and it's spread throughout Asia, Europe, and now across a big ocean to this country. And it's in Latin America, South America. So it is become problematic. Now, a couple of things to know how it presents. It presents with cold-like symptoms or flu-like symptoms. Fever's big. That's the most common presenting symptom. Sore throat, cough, malaise, muscle aches, possibly shortness of breath. Okay, so that's sort of how this viral syndrome presents. Now, most people have a very mild, benign disease course. Most everybody. But for certain at-risk people, it can be a stormy course. So older patients, really mid-60s on up, have higher risk of a severe infection, as do vulnerable medical patients, those with cardiovascular disease, underlying lung disease, diabetes. In our practice, perhaps immune suppressed patients and patients with advanced liver disease or cirrhosis, particularly cirrhosis patients who are what we call decompensated, or who have a liver that's just not functioning on all cylinders. So we really want to be aware and cognizant of those at-risk individuals. So, what about COVID-19 and the gut? So, a couple of factoids regarding this virus and the gut. Importantly, it may present as a diarrheal illness. In fact, I read on Twitter this morning that at Ground Zero in China, estimated that 50% of their cases presented with diarrhea. And what was observed is that the patients who had diarrhea as the presenting symptom had a more serious disease course. We have to think about patients who come in with an acute diarrheal illness as potentially being infected. What that implies is that the virus is, and it has been observed, that the virus is shed in stool. Okay, so again, another potential way that this disease can be transmitted is fecal-oral. Lovely, I know, but we have to consider that. The liver can be involved. So what we're seeing is that liver enzymes and bilirubin are elevated in people with infection. Not all cases, but about 1/3. So be aware of that as well. Nausea has also been seen with the virus. So we do see some GI symptomatology, although it appears that the respiratory effects of the illness and just the the potential for a severe inflammatory response in the lungs is what leads to respiratory failure and ultimately death in a minority of these patients. So what are we doing as a GI practice here at my practice? You can reference my practice at bgapc.com, and we have some links to some important CDC resources on our website. We'd love you to check that out, kind of get to know us there. But what are we doing as a medical practice? We're pre-screening every patient that comes through our doors or elevators. And so there, we're on it. We're right there. We're going to meet you, greet you as you come off the elevator. We're going to screen you with a temperature, and we're going to give you a questionnaire assessing your risk for this coronavirus. And most people are coming through fine. We're seeing you just like a normal office visit. If there's fever or if you have risk factors, we're going to triage you elsewhere where you get the best care, and we can kind of protect you and protect our staff and other patients and protect our community ultimately. So that's really what we're doing. However, we're still very much open for business. We're available to see our current patients. We're available to see new patients who need us and who may benefit from a GI evaluation. That's what we do. It's our mission. It just so happens that we have to practice it right now with some safeguards in place. What about procedures? So endoscopy, colonoscopy, we're careful. So we're performing procedures totally gowned down and gloved up. We're washing hands diligently before and after patient contact. We're covering our nose and mouth with a face mask, and we're wearing eye shields. So that's every patient without question. We're minimizing physical contact with the patients as much as we can as well. One strategy that's worked well is that we have our patient families or friends who come with them as their escort to the procedure or waiting in the car. So we can avoid a crowded waiting room scenario. So once the procedure is completed, we call that patient contact that's waiting in their car. We have a conversation about the results, and then we have them come around and we meet them with the patient. So we're really accomplishing effective social distancing through that strategy. So it's worked really well, and I think the patients appreciate that. What about immune suppressed patients? In our practice, immune suppressed patients are going to be seen in our inflammatory bowel disease group of patients and in patients who are on immune suppressives for autoimmune hepatitis primarily. And so these patients, right now, we're telling you to stay on your medications. Now, it's a decision that needs to be made on a case-by-case basis, but our starting point is to keep you on your medications. We feel like, for now, the risks of your disease flaring and causing problems off of immune suppression is significantly greater than your risks of acquiring COVID-19. So that's where we are in immune suppression patients, but we also urge all of you that are immune suppressed to really be cautious. I've got a spiel. This is what you need to do. This is what you need to avoid. There you go. Social distancing, word of the year, phrase of the year. A couple of other thoughts I wanted to share with you before we wrap up this episode. Telemedicine. So that's come to the forefront as a way to reach out to patients, our patients, as a method of convenience, and just to make ourselves more available to our community. And so we've implemented two mechanisms that we can interact with you remotely. One is just a conventional telemedicine office visit where we basically schedule you like we would schedule any clinic patient, but it's a telemedicine visit. And so we'll call you and we'll have a visit. We'll interact verbally on the phone. We'll talk through your issue, whether that's a new issue or a follow-up visit on an established patient. And we can make recommendations, place orders, prescribe medications, etc. So more of a traditional telephonic approach. We've made it available for you to log on to a website, and you can leave us a message, a detailed message about a question or a concern that you have. And again, it can be an established patient or anybody, and we'll basically get an alert on my cell phone. And I can take a look at that on my dashboard. I can review your issue, and we can leave you with our expert opinions, recommendations, straight to your account. So really cool way to kind of interact with you in addition to the sort of day-to-day office visit protocol that we're accustomed to. So you can check out our website again, bgapc.com. You'll see some calls to action on how to interact with us that way. And I'll leave some, in the show notes below, I'll leave a link to that, that technology. So that concludes this special edition of the GI Show on COVID-19, what you need to know through the lens of gastroenterology. So stay well, don't panic, we're going to be fine, we're going to weather the storm together. So from the shadow of Vulcan, so I can stay socially distant, keep you regular.